So today we will be discussing one of the most intricate and one of the most important and active parts of the upper extremity, which is the wrist. So we will be talking about the range of motion testing and the muscle length testing. Okay, so for the contents, first off is the range of motion testing procedures, under which are the wrist flexion, wrist extension, wrist radial deviation, and lastly is the wrist ulnar deviation. So on the second part is the muscle length testing procedures. So under the wrist flexors are the muscles flexor digitorum profundus and flexor digitorum superficialis. Next is the wrist extensors, which are the extensor digitorum, extensor indicis, and lastly is the extensor digiti minimi. So for landmarks review, as you've seen, both of these pictures show the posterior view of the upper right extremity. The picture shown above is about the surface anatomical landmarks, and the picture below shows the bony anatomical landmarks. So here are the landmarks. On the other hand, for the lateral view of the upper right extremity, so the picture above shows the surface anatomical landmarks, and the picture below shows the bony anatomical landmarks. So these will serve as reference for the succeeding tests which we will perform. So first off, I will be discussing about the range of motion testing, specifically here on the wrist flexion. So movement here is on the sagittal plane around a cardinal axis, primarily at the radiocarpal joint. So flexion also occurs on the mid-carpal joint to a lesser degree, while the proximal row of carpal bones glide posteriorly on the distal end of the radius. So normal range of motion values for adults vary from about 60 to 80 degrees. And there are different positions in this test, which we will further discuss and demonstrate as we go along in this presentation. So first off, we have the goniometric alignment. So the axis is center over the lateral aspect of the wrist just distal to the styloid process of the ulna. So I will show you the picture. So here it is. Next is the stationary arm. So the stationary arm of the goniometer is where the arm should be fixed and should not be moving. So this should be aligned with the lateral midline of the ulna, which sits in the olecranon process. Lastly, the moving arm is aligned within the lateral midline of the fifth metacarpal bone. So here we have positions. So as I have said a while ago, there are different positions during this test. So the left picture here is what we usually do. And the second picture, which is right over at the right side, is the alternate position where the arrow actually points at. So this is done because some patients might have edema or swelling. So this is just to get a better measurement of the ROM. So for wrist flexion, the alternative goniometer alignment is on the dorsal aspect. So the axis of the goniometer is where the central fulcrum dorsal to the wrist joint near the capitate. And then the stationary arm of the goniometer is aligned in the dorsal midline of the forearm. And the moving arm is aligned within the dorsal aspect of the metacarpal. Okay, so next we have the wrist extension or hyperextension. So motion here is on the sagittal plane around a coronal axis primarily at both the radiocarpal and metacarpal joint, with extension occurring more extensively at the radiocarpal joint. So the normal value for adults vary from about 60 to 75 degrees. And then again, there are two different positions in this test. So here we have the wrist extension or hyperextension's goniometric alignment. So this is the first position. So the axis of the goniometer is at the lateral aspect of the wrist, just distal to the ulnar styloid or at the triquetrium. Second, the stationary arm should be aligned within the lateral midline of the ulna, sitting the olecranon process. And the moving arm is aligned within the lateral midline of the fifth metacarpal bone. So, as I've mentioned again, there are two positions. The first picture here on the left side shows how we usually do the test, and the second again is the alternative position. So for the wrist extension, the alternative goniometer alignment is on the palmar aspect. So the center fulcrum is palmar to the wrist joint near the capitate. Second, the stationary arm should be aligned with the palmar midline of the forearm. And lastly, the moving arm should be aligned with the palmar aspect of the third metacarpal. So here we have the research findings for gender. Usually, there is more wrist motion in females compared to males. In age, as age increases, so the wrist motion decreases, and it is evident in seniors. However, also in younger children, nagadevelop pa lang, they also have wrist or decreased wrist motion. And other factors involved are BMI. So BMI, there are no significant effects when it comes to wrist motion. When it comes to handedness, as seen sa left versus right, there is no significant man nga difference when it comes to the handedness of a person. And when it comes to testing position, so in a supine position, there is more wrist motion when it comes to ulnar ulnar deviation. And if the forearm naman is in prone position, there is more wrist motion in radial deviation, in flexion and extension. So that's it. Thank you for listening.